Hello, and welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Michelle Wargo. We have a lot in store for this month's episode, including: could you be at risk for falling? Stay tuned to learn what some local residents learned at a free balance screening. You'll meet a man who is looking forward to knee replacement surgery after the procedure on his other leg got him up and moving with little discomfort. And we'll visit with Chef Dave, who has a recipe that will get you in the mood for fall. First, we begin with an extensive look at breast cancer awareness by introducing you to someone who plays a vital role in cancer patients' care. The diagnosis of breast cancer can create an abundance of emotions, information, and complicated treatment for a patient and her family. According to a recent study, patients who enlist the help of a patient navigator, such as Georgeann Bjornson, experience fewer problems with care as well as greater patient satisfaction.
It has been documented in so many journals and so many different aspects of oncology that really they are looking at the Cancer Care Navigator as really being basically the linchpin in keeping our patients, our caregivers, our family members kind of on a correct track. Also, the networking between the other hospitals makes it easier for if a patient needs to go to a different facility for different types of treatments, we're able to make that connection immediately and allow that hospital or facility that's going to be accepting that patient have a full update on what's occurring with that patient. So it's a huge internet and navigational system, and it's really helping people down that very difficult road, because until you're walking that road, you have no idea of the healthcare situations that will occur and all of the obstacles and the barriers.
Angela Hamblin of Eustis relied on Bjornson after her breast cancer diagnosis earlier this year.
I decided to go ahead with a bilateral mastectomy. With my family history of breast cancer, I just felt that at my age, and usually people my age have more aggressive cancers, I felt it was the best course of treatment for me and for my family. Georgeann was a pleasant but neutral face in my diagnosis. You know, when you're afraid to discuss your fears with your family or with your friends, you know, she was somebody there that was knowledgeable and helpful, who could point me in the right direction to questions I had in regards to the library that's here at the Cancer Center. Thankfully, it was a lot easier than I anticipated. I think that they were impressed too with my recovery time. It was a couple weeks till I got back to work, but full activity was about 3 weeks. So,
the number one thing when everyone hears the word cancer is they really truly feel that it has now become some type of a death sentence to them, and it's very difficult to get people to understand that basically if they are caught at a very early stage, that it is very treatable, very curable.
Lake County specialists are especially pleased with advances made in treating breast cancer. They credit more personalized treatment protocols, which help contribute to a better survival rate with fewer side effects. Doctors also say screenings, which help with early detection, are key to surviving breast cancer.
We're really learning from breast cancer how to personalize the care. Actually, breast cancer probably was the first cancer that we had targeted therapy, which is tamoxifen, the hormonal therapy. So it's very exciting, the news about newer drugs coming out and the ways we're finding how to personalize the care and just attack the cancer cell. So patients not only will live longer, they'll have better quality of life. It will be one day where you cannot tell who is a cancer patient, who's not, because they're all gonna look the same from the therapy we have.
Right from the imaging techniques to the medical oncology, radiation oncology facilities, as well as the expertise in surgical oncology, where we have this, the largest experience in Central Florida, has really put us on the map in terms of surgical oncology, and also in offering our residents national level care which most people seek.
Doctors credit medical team collaboration to determine the best course of treatment as ultimately contributing to a patient's success. While 1 in 8 women will be diagnosed with breast cancer in their lifetime, we know early detection is the best hope for survival. The Pink Army has mobilized to educate women and those who love them about the importance of regular screenings.
The monthly breast examination is very important. And I do tell people sometimes they come in with a palpable thing, it turns out to be nothing. I tell them don't keep on touching every day. Do it every month because you'll get paranoid about it. But at the same time, don't neglect it.
Mammograms are another important screening. They take just minutes and save lives by catching cancer early in its most treatable and beatable stages.
I know there have been studies saying that mammograms have a limited role in certain things, but I still think that's the best tool we have, and it'll help us. There's no excuse not to get a mammogram above the age of 40. When you're covered by the insurance company, you're covered for a screening mammogram.
The Pink Army has made it even easier for women in Lake County to get the screening. You can visit the website jointhepinkarmy.com, where you can schedule a mammogram screening online. And consider signing up to join the cause or making a donation to help underserved women get access to medical screenings for breast cancer. You can find more information about the Pink Army, as well as a wealth of information and resources right here in Lake County by visiting fhwatermancancer.com. It's time to take a break, but we'll have more information to share when Waterman Wellness continues. Chef Dave will tempt our taste buds when we visit the Con Recreation Health Center kitchen to learn a recipe made with a favorite fall ingredient. You'll find out what local residents learned about the body's warning signs for falling after attending a recent balance screening, and a local specialist explains why his patients are undergoing significant joint procedures with little or no discomfort afterwards. You'll want to watch. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery, and you'll also find a listing of the specialists featured in this month's episode. First, Waterman Wellness wants you to know about the following community events that you or your loved one might want to attend. We'll be right back. Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Michelle Wargo. We now turn our attention to a successful effort to get people moving despite joint pain, and they can get there relatively pain-free. For some people, just walking across a room can be painful. That discomfort, sometimes due to joint pain, leads to inactivity, which can seriously impact one's quality of life. Specialists right here in Lake County are using a technique to help repair the damaged joints, while patients experience little post-procedure pain.
The pain-free joint procedures is something that I probably started to develop probably 8 or 9 years ago, and this is a part of it. But basically, even with my knee replacements, partial knees, hip replacements, shoulders, we have a pain regimen that we do, and we start 2 hours before the surgery.
Late last year, Michael Ahearn of Leesburg visited Dr. Perry because even walking was difficult for him.
He looked at the x-rays and he said, okay, you need 2 new knees. And my immediate question was, which one should I get done? And he says, whichever one you want. That's what we did.
In December of 2014, Dr. Perry performed the first knee replacement therapy on Ahearn's right knee.
We think we spent 4 days here. We did some very minor exercises here. And then when we got home, they had a home health care nurse and an exercise lady came. I mean, I could walk when I went out of here. It's just that, you know, your leg is as stiff as a board. There wasn't a tremendous amount of pain. There really wasn't.
There's different techniques we do during the surgery, and after the surgery we have a certain protocol that we put people on. So we have patients who never have to request or inquire about taking pain medicine after the procedure. And so we are proud of the fact that we've had some of the lowest pain scores in the hospital for several years. You know, when I first started doing this years and years ago, people just had the fear, well, I don't want to have something done because this is going to be too painful, and we're trying to change that.
I shoot skeet and I shoot trap, and just walking, my right leg is very solid. When I put the leg down, it feels like solid. When I put the left leg down now, the one that I'm getting the knee replaced, sometimes it feels a little whooshy, like you're gonna fall.
If you or a loved one experience joint pain, visit the website on your screen to find a specialist who may be able to help. For some people, just walking across a room can prompt concerns about the potential for falling. Falls are the leading cause of injury-related deaths in people over age 65. The causes of imbalance may surprise you. Recently, Florida Hospital Waterman invited the public to participate in a free balance screening. Participants met with Rehabilitation Institute certified therapists who examined their risk for falls based on vestibular or nervous system issues or muscle strength.
We are looking for problems like the brain is not reading the information coming from the rest of the body that reads the balance, like the ears or the joints or the muscles not being able to hold up the person. All of them can be different causes of. Like aging process can cause circulation problems in the brain. Medications can mask the normal readings of balance and tell the body that is a balance issue when it is not a balance issue.
Gutierrez says many people don't realize that often the source of imbalance is literally in their head.
Actually, we have a balance center on the ears that it works like it reads where our head is, like on the position in the space of the body. So it tells the brain where we are and what adjustments we need to do. Sometimes can be read differently. We may have crystals in the ear that are floating, and that gives us a misreading of the position of the body.
If the screening determined the person has a balance issue, the Rehabilitation Institute has programs to help.
We have a vestibular team here that will be able to do certain maneuvers to readjust the vestibular system and have the sensations read normal. If it is a different cause, let's say muscle weakness, we'll go through a balance program which will include strengthening, balance training to get the patient to be able to function.
If you or a loved one is experiencing balance issues, check out fhwaterman.com to find a specialist who can help with the diagnosis and treatment. It's time to head to the Connery Creation Health Center kitchen, where we'll learn how to enjoy the aroma of pumpkin pie all year long thanks to a new recipe. And you may be surprised by its health benefits. Fall is my favorite time of year, especially because of all of the seasonal ingredients that are now available, especially pumpkin. So today we're joined by Florida Hospital Waterman Executive Chef Dave Atkinson, and we have registered dietitian Stephanie Bassett here to share with us a delicious bread that will be great as a snack, as a lunch, as a breakfast, and as a dessert. So what are we making?
We have pumpkin bread today.
Oh, I love pumpkin bread. So excited. What goes into it?
This is a quick and easy bread. We have some dry ingredients. We have flour, cloves, and we have sugar, pumpkin, canola oil, raisins, applesauce, eggs, and yogurt. What we're going to do is cream together our wet ingredients with the sugar. So we'll take our pumpkin.
So Stephanie, why is pumpkin bread something that's actually good for us?
Pumpkin is great. It's actually a really good source of beta carotene, which converts to vitamin A in our bodies, which is a really powerful antioxidant.
Oh, I love antioxidants. Why do we need antioxidants?
They help fight free radicals in your bodies to help prevent against cancer.
Oh, okay. So this is a delicious bread that fights cancer.
Yeah. You can say that.
All right.
And then we're just going to stir in our dry ingredients.
Now, do the spices like clove and cinnamon, do those have any benefits?
A lot of the spices do have some antioxidant qualities to them, so they are good to incorporate. You just don't want to overdo it in terms of, you know, powerful flavors and things like that.
I love it with a little spice touch.
Yeah, those spices are all classic spices that go along with pumpkin. You can already smell that it's starting to smell like pumpkin pie. And then finally we'll fold in our raisins, which are optional. You don't have to add raisins. You could add nuts also if you wanted to. So we'll just spray our loaf pan with a non-stick spray. And we just want to fill it about 2/3 full. So we're just going to take this and plop it in the oven for about 50 minutes or so, 350 degrees.
So in the beginning, you mentioned that this bread can actually help us fight cancer. How?
Yes. A pumpkin is a really good source of antioxidants, and more antioxidants we eat can help prevent against cancer and can fight against cancer. It's been shown that in their lifetime, 1 in 2 men will develop cancer and 1 in 3 women.
Wow.
So it's very important for us to help control our lifestyle factors, which mostly include diet and exercise. And if we can control those factors and get early detection and screening of cancer, it may help prevent more than half of most common cancers.
It's been about 50 minutes, so let's check and see what it looks like. Looks good. It's nice and golden brown. And you can see the applesauce and the yogurt and the oil, of course. We'll keep it nice and moist inside.
All right, well, let me try a piece.
I'm so jealous.
Tastes like fall.
It's exactly what we wanted. Well, Chef Dave, thank you. And Stephanie, thank you. If you'd like the pumpkin bread recipe, visit watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the November episode right here on Lake Sumter TV for some of the following stories. Find out why important screenings for colon cancer aren't as bad as you may think. We'll hear more from a local specialist. A Tavares pediatrician helps explain when a child's congestion and coughing could be more serious than a cold. And we'll head back to the Con Recreation Health Center kitchen for a one-pot recipe that is especially good for people with diabetes. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Michelle Wargo for the award-winning Waterman Wellness.